we're going to see all the nutrient supplements that can help live longer. And you will see, you will get an overview of much more than just 50 micronutrients, because I'll give you some very exciting information based on very scientifically deductions, actually, from mortality studies with these nutritional supplements. But you will see, I will mention how much more years of life you can have by taking a nutrient supplement or by keeping the nutrient supplement at relatively average or high levels, depending on the nutrient. And that's really essential information. Why? Because why would you give a nutrient supplement that does not have an impact on increasing longevity? That's much less important than one that can increase longevity, because living longer is also related to better health in most cases. So it's possible with micronutrient supplementation to live longer, and you will see that it can be even substantially longer with some of those micronutrients, especially in ill people. And first of all, I want to give a great thank you for those who are paying for the translation, Sunday Natural and Colegio Mexicano de Ginecologia, Laser and Functional. And you see, un grand merci pour la traduction française de Sunday Natural, and muchas gracias para la traducción al español para Colegio. Really, it really helps to get more people. Now, first of all, I'm going to see the amino acids, and I'm going even to go a little longer on amino acids because they are the building blocks of our body. And those building blocks also help to live longer. And before I really go into those amino acids, let's look at what type of amino acids. They are the total, the mix, the essential amino acids, the non-essential ones, the ones that you can get from the food, but that become essential, many of those essential in some critical situations. There's also the branch chain amino acids that are three: leucine, valine, and isoleucine. There's arginine, carnitine, glutamine, glucosamine, N-acetylcysteine, and glutathione. And so I have a whole module that explains that in details. It's 7 sessions of about 2 hours online, and I can tell you, you will be absolutely excited by the information that is there. And here are the minerals also that may an important impact: magnesium, calcium, phosphorus, sodium, potassium. I haven't seen a study with sulfur, but sulfur could also be added if one day there will be a study published, because all the information I give is science-based, but it's also practically based on my personal experience in more than 50 years in those nutritional therapies. There's also the fat-soluble vitamins and related nutrients. There's vitamins A, D, E, K, alpha-lipoic acid, coenzyme Q10, and then the vitamin Fs, which are actually the omega polyunsaturated fatty acids that are omega-3, omega-6, are also the monounsaturated like olive oil. And there are studies on all these single nutrients that show that they can decrease mortality at high levels or average levels, or when supplementation is given. And there are also the water-soluble vitamins that we'll overview: the vitamins B1, B2, B3, 5, the B5, B6, B7, B9, B12. All have had important effects. There are some of the vitamin Bs that have no effects, like vitamin B10, para-amino benzoic acid, where I didn't find any studies. And there's also vitamin C. And then there are the trace elements like boron, chromium, copper, iodine, iron, lithium. Lithium, fantastic. Increases all-cause mortality. No, decreases all-cause mortality. Selenium and zinc. And plant extracts like ginseng, miscellaneous like we'll talk about quercetin, quercetin, spermidine, PQQ, polydatin, epitalon, rapamycin, glycocalyx, and others are of importance. But basically, all these here, not the miscellaneous ones, there are studies on humans. Although in spermidine there's a study in humans, that show very interesting effects. And also with the longer molecule, epitalin is a shorter peptide from a longer molecule called epithalamine that has shown longevity effects by supplementation on humans. Interesting is to know is that there can be given different types of doses, and amino acids are almost always given in grams per day, while minerals are milligrams up to grams per day. For potassium, often grams per day, milligrams for magnesium, for example. Fat-soluble vitamins are usually in micrograms or milligrams or grams per day for the polyunsaturated fatty acids, for example. The vitamin Bs are then in milligrams per day in general, your 100 milligrams, 50 milligrams, 250 milligrams, and 1 milligram for vitamin B12. Trace elements you have boron, chromium, copper, iodine, and things, and they are given in micrograms or even milligrams, but never in grams. That would be toxic. And then plant extracts, milligrams to grams per day. And miscellaneous, those they usually are in milligrams per day. And I use a lot of these nutrients to improve the longevity of my patients. And it's not only a healthy LVHS drive, it's a joyful longevity because it's no use living longer if you don't have joy and if you don't are not happy. So that's always an important part in my practice is making patients happier for the rest of their life, that they have a lifestyle that really pleases them. So the amino acids, let's look into, they're the mix of all types of, or many, we'll see what it does on longevity. So you can take a supplement mix or you can a specific amino acids to improve longevity. But what is important to know when you want to give an amino acid supplementation, I insist this, is like for hormones, you need also our nutrients to know what the physical signs are of a deficiency in amino acids so that you can recognize in your patients. And when you talk about global amino acid deficiency, there's globally overall physical signs that you see almost in all sorts of amino acids deficiencies, and that is premature aging. Premature aging person, what you see is amino acid deficiency. And you see wrinkles are always with a lack of amino acids. That's why there's a shrinkage of the skin and sagging skin because you need amino acids for the elasticity of the skin and to hold it together. And a thin skin, of course, thinning, less volume, and the sarcopenia, the loss and the sagging muscles, which means if it's due to an amino acid deficiency, you can also correct at least partially by giving an amino acid supplementation. And also the lax, poorly toned body overall is a sign of amino acid deficiency. And then you have other signs, the fatigue, the low immune system. They have infections, one after the other, often in amino acid deficiency. And there's a loss of functional abilities, like you see. That's why this woman wears a cap. Now, it's not enough just to give amino acids to an older person. You also need to give the hormones, often to get optimal effects. It's a combination of effects on these muscles and the skin and the hair to improve it. So we see that there's something special is that dietary amino acids, the one you have from the food, you may not take too much or too little. And we are often overeating. That's too much amino acids. And when you're undereat, that's also not enough. So malnutrition is linked also to more mortality. So that's why there's a U-shaped mortality curve. And let's look at the Iranian adult study. More than 47,000 Iranians, mean age is the middle age. And what you see is that the lowest quintile of dietary intake, that means the 20% lowest consumers of amino acids, compared to the middle quintile, which is the average quintile, which is ideal, the 20% who have, let's say, the optimal intake of amino acids. After 15 years, the all-cause mortality is minimum for essential amino acids around the 22.3 grams per day of intake. If you take more, there's an increase of the mortality or cause. And if you take less, there's also an increase. That is a U-shaped mortality curve. And the branch chain amino acid, the one you need for muscles, but it's not the major ones for muscles. The major one is glutamine. And the branch chain amino acids, leucine, valine, and isoleucine, you see that it's around the 12.2 grams per day that there was the lowest mortality. Higher levels or lower levels give actually more mortality. And then there's the sulfur-containing amino acids, where there's also a U-shaped mortality curve, where ideal intake of those sulfur-containing amino acids are good for the hair. I take um, precursors to them so that my hair is really thick and grows well. And well, those not more than 2.7 grams per day should be taken for longevity. And because there's also a U-shaped mortality curve, which is actually the clearest with the essential amino acids. And here's a study where that is important to tell is that when you take too much proteins, it is actually not so good for middle-aged patients, but for patients who are older, because they're so deprived from amino acids, high protein intake usually decreases overall mortality and the cancer mortality and incidence in old adults. But below 65 years of age or at 65 years of age, there's not such a good at very high intakes of proteins, not so good results. And actually, there's probably something missing here in these studies, is that it's not the proteins that are dangerous, it's the way how you cook and bake the proteins, because usually meat, for example, is grilled or is cooked in oil, and that's absolutely not healthy. And this study indicates that indirectly. We'll see. You see adults aged 50 to 65 with a protein intake that's more than 20% or at 20% of the calorie intake, 75% overall mortality, and fourfold more cancer mortality. Why more cancer? Because exactly when you cook at high temperature in oil, for example, meat, or you grill it, it becomes toxic. The black stripes are carcinogens or pro-carcinogens. And so you will get more cancer, die more from cancer, and that pushes up the overall mortality. Now, interesting is the association were abolished or attenuated if the proteins were plant derived, because it's much less toxic to burn your plant food than to burn meat. That really becomes dangerous, burning meat. So adults over 65 years of age reporting high protein, they don't have that. Even if they eat toxic, it's still overall better to have more proteins. But I bet it would be much better if you cook the foods like I put in the oven at 85 degrees Celsius, which is 185 degrees Fahrenheit. The meat in the oven and slowly cooked, but basically healthy. Or I boil the meat or steam or even raw. That's all better than cooking in any type of oil, even olive oil or coconut oil. Some of it becomes toxic by the cooking. So after 18 years of follow-up, what do you see? You see that the high protein intake uh, actually there's shorter time to predicted time to death, shorter time to death. While afterwards, at older people, it becomes the best way to live longer. And same for cancer mortality. You see the difference, much difference. High protein intake, but again, most people cook their meat wrongly. And you see high protein intake, diabetes mortality, low protein is always better at any ages. 100% understand exactly that mechanism, but at least you have the information. So across all ages, fivefold more diabetes mortality. So if you have diabetes, you should probably restrict your protein intake, especially the toxic protein intake, because maybe it requires more from the pancreas and exhausts the pancreas to eat toxic protein. Okay, so low protein during middle age, followed by moderate to high protein for some old adults, may optimize the health span and longevity. So, um, but it's mostly, I think their listing a factor is the how the way people eat the proteins. And good proteins is also milk products, but we know that dairy products increase atherosclerosis. So that's not a good alternative. And that we know also that milk products are very bad for diabetes because they even can cause diabetes in young people, insulin-dependent uh, diabetes. So consume animal products, take amino acid supplements for longevity. You should, if you take too little meat or other protein intake, like 150 grams, less than 150 grams a day, that's for most adults insufficient. In that case, you can take collagen peptides, for example. You add the hydrolyzed collagen peptides, and the doses that I take is between 10 and 20 grams per day additional. And I have seen on my body, my skin become tighter and my muscles become better. I'm not yet good for the competition, but I find it's not bad. Okay. Um, and okay, now carnitine is an amino acid that is not in the top amino acids that we essentially need from the food or have to make, but because combination of amino acids, but basically it is one of the best nutrients for at least for people with heart disease to survive much longer. And the carnitine deficiency, what are the physical signs? Again, you have to ask yourself, can I recognize that in my patient? And first of all, carnitine deficiency is something rare, pure carnitine, but we have a lot of people being borderline low in carnitine. And if you don't are not able to utilize or produce carnitine, the common sign is muscle weakness. The people who have low carnitine is muscle weak. And an example are cancer patients or post-cancer patients after removal of cancer, stay tired and they get better, more energy with carnitine. So if they have muscle weakness as a sign, carnitine is necessary. Low blood sugar, particularly in infants, hypoglycemia, and erectile dysfunction because it in some conditions works better than testosterone to improve erections. And these carnitines can increase penile blood flow, nerve function, and penile fibrosis, and decrease penile fibrosis, like in Peyronie disease. So it's really something helps for erectile dysfunction, but you need higher amounts, 4 grams, 3 grams of L-carnitine, for example. And so there's always fatigue in people with low carnitine. And so there can be brain dysfunction. You're not so good in your brain, and heart dysfunction. So it's really important because it works on the mitochondria. It permits to utilize fats and transform them into energy. And so if you go on a high fat diet, you should have enough carnitine or it will not give you much more energy. And so L-carnitine supplements for longevity, for an example, that's an extreme example, you will see that it's quite interesting to see that 4 grams of carnitine for 12 months in people who had a myocardial infarction, and compared to those who had the same pharmacological treatment but didn't take carnitine, 10 times less 1 year mortality, minus 91% mortality. Only 1.2% died compared to the 12.5% of the myocardial infarction. This almost obligatory treatment of the myocardial infarction. And also improves the heart rate, decreases the systolic blood pressure, and the number of attacks by angina were decreased, and also lipids were improved. And there was non-significantly a slight decrease in diastolic blood pressure, in arrhythmia disorders, and also of impaired myocardial contractility. And you know that if you give that to older patients, 1 month of L-carnitine at 4 grams, they can decrease, I believe it was something like 1 to 2 kilos less uh, fat and 2 to 3 kilos more muscles. So it really can also change the body composition at these doses. And that's really a very safe amino acids you can take. So consume dietary or supplemental carnitine that will increase longevity. And so the dietary, an omnivore's diet normally gives enough carnitine because in 200 grams of meat, you find 60 to 160 milligrams per 100 grams or carnitine supplement. And then that's usually given to vegan or vegetarian diets. So there's always a little sign appearing above my screen. And so in vegan and vegetarian diets, and possibly vegetarian because vegetarian diets do have protein, while vegans not, at least not animal protein. Carnitine, 2 to 4 grams per day would be good doses. I personally take around 4 grams, I believe, 3 to 4 grams, because I take a mixing of powder of amino acids and and or acetyl L-carnitine, which is a more efficient form of carnitine, 1 to 2 grams per day, can be sufficient in my experience. And for longevity, you keep the total carnitine levels high normal. And I've studied this for most nutrients. What is the optimal level to live longer? And usually it is slightly above the average level, but some levels can be low, rarely, but it can be, I think, must be 5 or something. You need rather to stay low. And other levels may be very high. And that's carnitine in disease, for example. So normally this is high normal within the reference range. But if you take acetyl L-carnitine, you can go to the high level also. Um, Especially in disease, you can go higher levels here, heart disease mainly. And then glutamine is one of my favorites because it's the often forgotten amino acids in longevity or in muscle building, while it's very important. In order to understand that, when you look at 100 grams of muscles, there's 12 grams of glutamine. That means it's the most abundant amino acids. Most of the muscles are like our body made of water, but you see that there's 12 grams, is at least 12%. And when you compare it with others, like the branched chain amino acids that are known to build up muscles, they're less in the muscles than glutamine is, 7 grams together. And among that, the most abundant is leucine, 2.5 grams of leucine. And then there's 2 to 2.5 grams of arginine in the muscles, and just 400 grams of creatine, 200 grams of taurine, and 100 to 200 milligrams of carnitine. So it gives you an idea where all the importance of glutamine. Now, you would say, but I'm giving more creatine, I'm taking more creatine, or I'm taking more carnitine. Yes, because here we're talking about 100 grams of muscle. And in a human body, in a man, for example, who's more muscle than a woman, you find 30 kilos of muscles on average, between 25 and 35 kilos. So you have to multiply these figures in the body for the presence of glutamine in the body by average 30. So that makes already like 360 grams of glutamine in the whole body. And that's already much more, of course, as a quantity. So what are also, that's the question you need to ask yourself, what are the signs of glutamine deficiency? And well, you can have neurological problems. You can have a decrease in immunity. Glutamine really boosts the immunity. So when there's not enough, you get infections. And there's also muscle loss and wasting, sarcopenia due to decreased protein synthesis. And there's digestive issues like ulcers, diarrhea, weight loss. So when you have digestive issues, generally you need to get some supplementation, glutamine. And it also is accompanied by physical and emotional fatigue and also more depression. And so the glutamine supplements, if you give oral glutamine 50 to 30 grams, which is quite a lot, compared to, to intake at least. After 4 years, people who took that and had fistulas in the intestines, it improved 13 times more the healing of intestinal fillers compared to those who didn't take glutamine. So it really helps these type of patients when there's something abnormal in the intestines. Here it was given to non-small cell lung cancer patients. It also significantly increased the survival to take 3 times per day, 10 grams of oral glutamine. And that's without danger, I would say, if they take other amino acids. And given intravenous glutamine also improved the survival of burn patients, 4 times less mortality. And in parental nutrition, again, intravenously given, it more than doubled the survival of critically ill patients. There was less infection, less multiple organ failure. So this is also something missing or really important for people with critical illness. And what about N-acetylcysteine? NAC is the common name and that people like to use. And the supplements can also increase longevity. I have here a retrospective cohort study with patients with COVID-19, more than 19,000. And most of them didn't receive NAC, but more than 2,000, a little bit more than 2,000 received oral neck, and that was perfect for them because it helped them to survive. And so the doses that were given were every 8 hours, 600 milligrams of N-acetylcysteine, and there was almost 2 times less mortality. So it really helped them survive better. And another study confirmed the same. Study here by published in Infectious Disease Journal of London with COVID-19 pneumonia because it's also an immune booster. And so doses that are useful is first of all, you won't find it in the food, but you will eat, if you eat foods rich in cysteine, that's sulfur-containing amino acids like poultry, eggs, dairy products, and cruciferous vegetables, garlic, and things like that, you will have a bit more NAC in your body. And NAC, you have, if you give 600 milligrams with some interruptions, because this is a very important information, is that everything that can be antioxidant, and NAC is antioxidant because it converts to glutathione, which is intracellular, probably the most potent antioxidant. And everything is antioxidant should be interrupted. Otherwise, you have not enough free radicals to kill cancer cells or in the genome to stimulate uh, the coming free of some genes so that there's some specific protein synthesis. For protein synthesis, you need the genes to be stimulated by free radicals. And so this is why I suggest you do 2 months yes, 1 month stop, or you do 5 days per week, and in the weekends you stop the NAC. That this would be much better method. And 600 milligrams is enough to live longer. But if you have a disease, or you do intensive sports, you might have to take more, and that's 2 to 3 times 600 milligrams. And this is a good treatment also for diabetes, but also cardiovascular diseases, Alzheimer's disease, premature aging. That's an indication for higher amounts of this glutathione precursor that is easily absorbable, while glutathione itself is more difficultly absorbed. And what about Glucosamine. Glucosamine, there are several studies, not just one. I think there's about 5 studies in humans that show that when people who take glucosamine live longer on the average. So glucosamine is a natural compound found in cartilage. And the supplements are made generally from shellfish. And there are several forms of glucosamine that include uh, N-acetylcysteine, glucosamine, glucosamine sulfate, and glucosamine hydrochloride, which is less used. And when we see here, we see that the glucosamine supplementation increases longevity. Uh, Here's one of the studies. That's a study from the United States with middle-aged and older adults. You see, these are bigger studies, huh? 77,000 and so on people. And they tried a lot of different nutrients, like the vitamins, the vitamin A, B's, and the D, and even garlic, fish oil supplements. And they saw that people who took them 4 days a week or more during at least 3 years had actually no benefit on mortality. Some other studies have shown different results, but I'm showing this that glucosamine was more potent to increase longevity. You had 70% less total mortality. Highest tertile of chondroitin is 70% less total mortality. Why wouldn't you have good effects with those vitamins where other studies? Well, doses that in big groups of people, those that they take usually are doses taken from multivitamins, for example. And those doses in multivitamins are very little. But if you take a nutrient supplement, doses higher, you probably would have with these nutrients better effects on longevity. And here with glucosamine, constantly it's at least 300, 400 milligrams per day minimum of each of these components, so you're on higher amounts. So that's why it's probably more efficient, but it's interesting to see that it's that what you take normally for knee pain is good for surviving longer. It's one of the nutrients. And so glucosamine supplement, there are doses for longevity. You see that glucosamine is found in shells of shellfish like shrimp, lobster, crabs, okay? And but you can buy it. And for longevity, what I would suggest of glucosamine alone is 500 milligrams. By also interrupting with moments, I like the body to be in what is called hormesis, periods where it's lacking deprivation, and then periods where it's rich in a nutrient. And that sort of fluctuation seems to work better for living longer. And you see also, but in acute condition, there's no hesitation. You need to give more. And for glucosamine, it's rheumatoid arthritis, diabetes, where it's also helpful, cancer and cardiovascular disease. You need to take 2 times 750 milligrams, for example. Chondroitin can be added, and then you can lessen the dose in disease of glucosamine, and especially in acute or inflammatory disease, they work well. But chondroitin is more specific for the joints, and glucosamine has a more overall function. Conclusion, when you look at the high amounts, serine but that's in the models. You'll have to look at the model, get all that information. But serine showed that it probably can give in ill people more than 3 years a longer life. And glutamine, 3 years of life in sick people, and also carnitine and NAC, also 2 to 2.7 years. At median levels, leucine can give, so not too much leucine. That means 4 years and 2.7 years here. Now, everything that is red here are ill people. When it's in blue, like here, that's the amount of extra years of life given to healthy people that are not known for a disease. And you see that in ill people, it seems to work better on these amino acids. Also, in ill people, glycine can work well. Phenylalanine has also shown in some studies to increase more than a year the duration of life. Arginine, 1 year, and with supplementation, In healthy people, when you give the two, it's about 0.7 years. So not so much for healthy people, more for people in disease with amino acids. And that's not always true with other types of nutrients. What about the minerals? Well, the minerals you have here recommended daily intakes. And you see that potassium is number one, 4.7 grams is recommended. And that calcium is 1.3 grams and sodium 2.3 grams. And so when you supplement, you should stay in that range or lower than the maximum. And magnesium, for example, again, please, when you try to detect magnesium, know the signs. And the person will be nervously overreacting with a tense body because, especially children, if you give magnesium to children, they don't get irritable or much, much less. You will see they calm down with magnesium. And tense lower back, so you can get lower back pain. Spasmophilia, I have that. If I don't take high amounts of magnesium and calcium, I get spasmophilia, hand spasm, calf spasm. I already had spasm that duration 30 minutes because I was in the car and I wasn't at home. I had no supplement I could take. Calf cramps, feet cramps, and afternoon fatigue, muscle tightness, and heartbeats that are irregular or more extrasystoles with tachycardia and constipation. And so when you see many of those signs, that can be magnesium deficiency. And when you supplement magnesium in this study in people with acute myocardial infarction, it was 60% more survival. And you see this less mortality by myocardial infarction. And the main reason is that those dangerous heart arrhythmias, ventricular arrhythmias, and heart failure was much less in these patients. And so to prevent, you need to, magnesium deficiency is first of all, eat a diet that is rich in magnesium. And that's often normally dark green, not light green. Dark green leafy vegetables are the richest in absorbable form of magnesium. But most people get in magnesium deficiency because they drink acid drinks, coffee, tea, and alcohol, even decaf, uh, puts the magnesium in urine. It's better to drink water or alkaline drinks when you have tendency to magnesium deficiency. Spinach has 80 milligrams per 100 grams. The spinach is darker green often, more magnesium. The darker the green of the plant, the more magnesium there is. Or you take a magnesium supplement, especially in people with a high carnivorous diet and low vegetable intake. And one of the best is magnesium citrate. But citrate is to take in the morning. At night is bisglycinate. Magnesium bisglycinate is more relaxing. Citrate gives more energy. So 300, 600 elemental magnesium per day is a good dose. And for longevity, you see that basically there are levels. And I searched all the studies I could find. So I think it had something like 15 studies where you had mortality linked to the serum level of magnesium. And when you combine all these studies, for healthy adults, the level seems to be a little bit higher of plasmatic uh, uh, magnesium, so magnesium in the plasma, and not the red blood cell magnesium, because I found no study on red blood cell magnesium linked or whole blood magnesium linked to mortality. So I have to show you what the serum of magnesium should be in millimoles is a lower amount. And adults with disease, the level was a little bit higher. Like if magnesium may not be too high in ill patients and not too low, but certainly not too high. And you see that the healthy level for healthy people, at least, is around 2.3 milligrams per deciliter, which is 0.95 millimoles. So in conclusion, for all the minerals, in ill people, it's probably more useful to use magnesium, but although you see that the levels in healthy people and in ill people are basically the same for survival. Potassium also 2.2 years longer life. And medium levels is for phosphorus and sodium. So you can take high amounts of magnesium and potassium without much risk, except that potassium, be careful with people with kidney failure, but outside of that, most of them do well with high amounts of magnesium and potassium. And phosphorus is can give in ill people who have low phosphorus a very good chance of surviving much longer, 5 years. And sodium also, you see, if you have a relatively average or level of sodium intake, that's good. So too high or too low are not good, but you can live almost a year longer if you have an average good intake of sodium. But if you have the patient with disease and a low sodium, it's almost 5 years longer life. But avoid calcium supplements in old adults with atherosclerosis because calcium supplements can give them calcifications. Or, and that's of course much better, you give the calcium and you add vitamin K2. So I take vitamin K2 next to my high amounts of calcium in order not to have any arterial calcifications. By the way, I can say I'm almost getting 69. I have absolutely no atherosclerosis, no calcification when they look at the arteries here, and then before they looked at the brain scan. So it's probably due to the hormone and nutritional treatment and the better food, etc. You can really make a difference. So minerals, also for cancers and cardiovascular disease, can have life-extending effects in the sense that you have a life longer without cardiovascular disease mortality or something like that. And again, potassium, magnesium are very good. Calcium also and sodium at even high levels for cardiovascular disease. Not dangerous, it's just good. And calcium and sodium seem to be good against cancer, especially calcium for decreasing cancer mortality. What about the fat-soluble vitamins and longevity? Well, these are all the fat-soluble vitamins. Vitamin F is actually the fatty acids, and vitamin K and E, B, D, and A. Beta-carotene can also be considered as fat-soluble vitamin. And let's look at vitamin D. And it can increase longevity when in people who had low vitamin D levels, especially below the 20 nanograms per liter or the 50 nanomoles per liter. And so it especially will make people live longer if they are critically ill. Also in the COVID-19 patients, especially if they with hypertension. And in the general population, generally a supplement of 800 international units per day, general population. And so when always interesting to look at the more important studies, the meta-analysis. And so this is a meta-analysis of 44 randomized controlled trials. And most of them, the 32 of them were done with vitamin D3, or some with the other type of vitamin Ds. And calcium was used in 26 of these trials. And vitamin D therapy alone had, when it was used for more than 3 years, was taken every day, there was a 6% lower all-cause mortality. In short time periods, no benefit. So you had to have at least more than 3 years in these to be sure to have a benefit. But you had better effects if there was in the beginning already a vitamin D insufficiency. That's not healthy. So those patients will benefit quicker also. Also, adults who are younger than 80, women benefit more than men, and low vitamin D dose that is below the or at 800 international units seem to work better to decrease mortality. So you don't need very high amounts apparently to live long. And the vitamin D3 was the most used therapy that really showed efficacy, not so much the vitamin D2 or derivatives of vitamin D. And the combination of vitamin D and D3 and calcium were significantly efficient to decrease mortality. So you add calcium, even better for longevity effects. And he has a meta-analysis of 38 trials for the COVID survival. And so more than 205,000 patients. And vitamin D supplementation decreased by almost 3 times less risk of getting in a severe form of COVID-19. And it improves the survival almost 3 times. And so that's at least in 8 studies here. And it decreased even better the mortality in older adults. So in the beginning of the COVID-19, I did a petition. I constituted a petition. I had about 100 health professionals, most of them doctors, but also some naturopaths and nutritionists. And we asked the government. We have in Belgium, it's extraordinary, world record, 9 health ministers for a small country. Per language, federal, that over building, we have 3 languages, German and French and Dutch. So each language has its ministers. And there was also in the general government. And none of them replied to us except one said yes, but I showed it to scientific committee. It's not scientific to say that you need to give zinc supplements plus vitamin D supplements. It won't help those patients scientifically. And basically, all the studies show that it does help. And we saved a lot of people because I know from the pharmacies, the petition was a bit international, nationally. We did a lot of fuss. I think we saved a lot of life of people because the pharmacies had a hard time to deliver vitamin D. It was sold so easy. And in conclusion, when you look at those fat-soluble vitamins, you see that vitamin A can give, on average in ill people, more than 3 years of life longer. But vitamin A, not all the time. You need to interrupt. Fat-soluble vitamins, you need to be more careful. You need to interrupt now and then. Ups and downs are good. Beta-carotene, 2 years. Lutein, in general population, 1.7 years. Zeaxanthin, 1 year, longer life. But you have to avoid vitamin A and beta-carotene supplements in mild smokers and asbestosis patients. Those patients don't do so well. It becomes pro-oxidant in them because they have pollutants like tobacco's pollutants that actually oxidize those vitamins into pro-oxidants. And at high levels, amounts you can give in vitamin D3 too. But you see that the people who are of disease will benefit more or as much as healthy people. And vitamin K1, vitamin K2. Vitamin K2 is better for bone stimulation. Vitamin K1 is better for coagulation. But you see the vitamin K1 in sick people who probably have bleeding disorders works well to make them survive at least 3 years more. At supplementation, if you combine both vitamin D3 and calcium, there's 1.7 years of more life. But you also should avoid vitamin E supplements in people who have a stroke due to a hemorrhage because vitamin E increases bleeding, so the blood becomes more fluid, but that will be not good for hemorrhagic stroke. That there can increase the mortality. So you need to uh, supervise the physician, your patient, and know this. Huh? So again, in general, population is in blue, and when it's more yellow, it means a greater effect. Brighter yellow is a greater effect, and when it's slight yellow, it's an important effect. When there's no background color, means that it's often less than a year efficacy. Well, it's more than 2 years often when it's in yellow. So you also have fatty acids, coenzyme Q10, alpha-lipoic acid, plasmalogens. Other types of fat-soluble vitamins you could call. And they can also extend life. In the Mediterranean diet, for example, the highest 20% of intake by the diet of fats shows that after 6 years of follow-up, there was in total fat less cardiovascular disease, 42%. So fat is not bad. Fat is good for the heart and the cardiovascular system. Monounsaturated fatty acids like olive oil, 50% less cardiovascular disease, and polyunsaturated fatty acid intake, 32% less cardiovascular disease. So there are a lot of safe fats. The saturated fatty acids increase cardiovascular by 81%. And you would say, but we need cholesterol or we need stearic acid and things like that. Yes, but it's often combined, and that's people who have high intake of that, are it's mixed with pastries and processed foods. And that's really what is not good with these types of fats. Don't They are often mixed with foods that are completely unhealthy. So there was a significant increase of cardiovascular disease by 81%, but probably mostly due to the fact that it's embedded into processed foods and pastries. And then trans fatty acids intake, we know that trans fatty acids are obtained by burning the food, 67% or cardiovascular disease. So the highest quintile of mono and polyunsaturated fatty acids against the lowest quintile in general had a significant decrease in all-cause mortality. The more you take of those monounsaturated like olive oil, polyunsaturated like omega-3, the better it is. And what are plasmalogens? Something bizarre? Well, plasmalogens are components of the membrane of many cell membranes, especially neurons, or myelin sheets around the axons of neurons. And they have a vinyl ether bond. That's the structure compared to the other structures of the glycerophospholipids that form the membrane here around the cell. And what we see is that the higher the blood levels are of plasmalogens, the lower the level is or lower the probability to actually become dement. Even if you have the ApoE4 um, um, genetic variation, which gives more risk of dementia. And you see that if you have high plasmalogens, you really have much less risk of dementia compared to low plasmalogen in the 5th percentile. And what is interesting is the probability of dying is even sharper in people with high plasmalogens compared to people with low plasmalogen, average plasmalogen, actually have the lowest mortality for overall. There's a much even stronger difference. And so if a person is 95 years old with high plasmalogens and he has the bad ApoE status, he has same mortality risk as the 65-year-olds with low plasmalogens. And that's surprising because normally every 8 years the risk of dying doubles, and here not. So you have a 70% chance, yes, of living up to 100 years because the mortality normally is very high. It's much better. And the one with a low plasmalogens has 20% chance of living to 100. So it really more than triples the chances to become a centenarian. And I would like to be a centenarian, so I take plasmalogens. It's not a secret. You may know it. And I found really my mind really worked better with the plasma. I saw a difference. Tell me a name, I don't pay attention. 2 days later, I know the name. That wasn't before the plasmalogen intake. Okay, so 56% lower mortality here, and there's a high mortality if the plasmalogens are low. Doses for longevity of plasmalogens is that there's a recommended daily allowance to take around the 900 milligrams per day, but more in case of disease. And so in the diet, you can have more than 500 milligrams plasmalogens. If you take 100 grams of mussels, you have 3 grams even. Scallops, uh, 7.5 milligrams, much less. Some shellfish and meats, pork can have lungs, kidney, brain eating, and beef brain, 6,000 milligrams per 100 grams. I don't think many of you are eating beef brain, but we have here something that is called calf's head or prepared sort of processed meat, which that is not 100% so good. But basically, it has a brain, calf's brain in it, and that probably has high plasmalogens because in the brain it's full of plasmalogens. And shark liver also, cervid meat, so wild game meat, cervid meat 375 milligrams per 100 grams. So you need to have the 900 milligrams, maybe take 300 grams. Or you take supplements like these, and I always take the firm name away to make it scientific. I don't have any um, royalties for what I do, and even if I would, I wouldn't accept it. And I like to have my freedom to be to propose the best products and to tell in a neutral way what you need to have in each product. So for longevity, and this is what I do, I take 450 milligrams of plasmalogen for the neurons, and for the glial cells, also plasmalogens, 450 milligrams. A little different, the composition of these plasmalogens. But if you have a disease, you have to double the amount. So disease is Alzheimer's disease, or even a cardiovascular disease, or liver disease, or neurological disease, and 900 milligrams of each. And coenzyme Q10 is a great treatment, but there are studies combining coenzyme Q10 and selenium in people who are healthy but getting old. Most studies with coenzyme Q10 show really remarkable effects, but smaller studies in cardiovascular disease or in cancer. And I like to see in the bigger studies with more healthy people because that concerns more your patients who are not really with a big disease or severe disease, and they want to prevent disease and to feel better. And so you see here that a combination of 200 micrograms per day of selenium and 200 milligrams of coenzyme Q10 for 4 years decreased the cardiovascular mortality by 53%. And a marker of heart failure, NT-proBNP levels were decreased by 29%. And these are older citizens from 70 to 88 years at baseline. So these people have a high risk of mortality, and you see that you have, at least for cardiovascular mortality, a sharp decrease. And the heart did function better with this treatment. And you see that 4 years of combined selenium, etc., were given. Then it was stopped the treatment for 10 years, and still the cardiovascular mortality was significantly lower, about 50% lower. And after 12 years stopping, 39% less decreased cardiovascular mortality. So just the fact that you give it 4 years, even 10 years or 12 years later, it still helps to live longer, or at least to live without dying from cardiovascular disease. And what about alpha-lipoic acid? This is a study in Hungarian with diabetic neuropathy. And what you see here is that after 11 years of follow-up, the all-cause mortality was 45% decreased by 600 milligrams of alpha-lipoic acid. And they had diabetic neuropathy, and you see that then the blood is not supplied well to the feet, for example, in diabetic neuropathy. Then it's painful, of course. You have tingling and the thing, but you also have these little openings, sort of necrosis, locally ulcers that actually open up. And so alpha-lipoic acid is given to heal that. But it not only heals that, it makes these people live longer. And compared to symptomatic pharmacotherapies, alpha-lipoic act make the people survive better, almost 50% less mortality after 12 years. In conclusion, what we see here is that high levels, you can give coenzyme Q10 alpha-lipoic acid without many danger, and you can make people who are ill with myocardial infarction, for example, 4 years live longer or 2 years live longer. In the general population, you could give plasmalogens, they could live about almost 4 years longer. And you can give also fish oils because there's a study also in the models I give about micronutrients. And there's 3.8 years, no, it's 2.7 years in healthy people more. So omega-3 fish oils work better in healthy people than in people with disease. Much better. So that's one of the differences here compared to most of other nutrients that seem to work better in ill people. And here it's in healthy people. So this is something safe to give to healthy people. Alpha-linoic acid, it's in a green that is less marked because it has less efficacy. That's the plant omega-3 fatty acids, or DPA, which is also fish oil in healthy people about a year longer life, which is still interesting. If I can live 1 year longer, I would like it. Linoleic acid, life is too passionate. I like it. At high levels, linoleic acid, that is the omega-6 fatty acids, 1 year longer in healthy people. And at high levels, you could give in general population also fish oil in general, where you don't distinguish between the DHA or APA, and omega-3 polyunsaturated fatty acids, about a year. It's not much more here, it's even less. Olive oil, half a year. Omega-6 polyunsaturated, maybe 0.4 years. What is important is to avoid toxic fat. Avoiding trans fatty acids like ellatic acids can make you live 2.4 years longer in some studies, and also avoiding fascinic acid, 0.6. These are not really good things for longevity. So I check these levels in my patients and give them advice not to cook with olive oil and maybe eat fresh food, then you avoid having in the food ellatic acid. Avoid linoleic acid in breast cancer because one study showed that linoleic acid is an omega-6, and that in breast cancer is not so good. 1.8 years, you can give supplement life in patients who had bad breast cancer following a study. Water-soluble vitamins can also increase longevity. You have the vitamin Bs. 6 of them can lengthen life. And among those are the vitamin B3. And you see that niacin, after 6.2 years, no statistical significant effects on mortality. But bizarre, when you go longer, you stop the treatment. 9 years after, there's 11% less mortality in those who took niacin before. Another study showed that it improved the cancer survival rates, double more survival. That's interesting. In high dietary niacin intake. In all-cause mortality and cancer survival was better, but also better all-cause mortality. Vitamin B9, folic acid, also that sort of information. I'm going to go a little bit quicker because I think we've seen most of the information, but even small dose of folic acid can decrease mortality in patients with hypertension and losing proteins in the urines. Here in liver cirrhosis, folic acid works. So in people with disease, seems to work well. So in conclusion, the water-soluble vitamins, the vitamin C can give you in general population about 2 years, like vitamin B2 too. And then other ones are a little weaker. And the vitamin B12 in ill people at medium amounts, not too much, 3.3 years. So medium serum levels. Actually, there's several studies that show that high levels of B12 are not good, but many physicians think that those high levels, borderline high or above the upper reference range, are actually just a consequence, not a cause. But anyway, let's just be careful and make that those vitamin B12s are at the average levels above 400 in the units. And that's good. Trace elements, boron. Boron is this sort of metal, and it's the 51st most abundant element in the Earth's crust. You can look at the lecture with trace elements, and you will see exciting things because you'll see how much of it is on planet Earth. And so it's very small fraction of the Earth's crust. And it has been shown in kidney transplant patients that if you have high levels in the urines, there's 2 times less mortality. You see the difference. This is lower tertile of urine. And when you're in the tertile 3, which is the highest tertile, 1.54 milligrams per 24 hours, you live longer as kidney transplant patient. And the higher the urinary boron concentration is, the less there's homocysteine inflammatory parameters. And people who work with boron know that improves the bone and it also increases the sex hormone levels. So that's quite good. And apparently by decreasing homocysteine. So if you have a low homocysteine, don't just give the B12 or the folic acid or the B6. Give also here boron, 3 milligrams is a good dose. And so the zinc supplements, zinc supplementation has decreased in one study 43% less COVID mortality. So what we suggested to the ministers, and that didn't take even the time to respond, was healthy. We would have saved a lot of more Belgians if we had their approval. We asked them actually to give supplements to the whole population in small doses, but those doses are efficient enough. Conclusion, trace elements, iron can also make, lithium can make you live longer, all-cause mortality better, especially if it's in the drinking water. And it also blocks Alzheimer aggravation. So it has many interesting effects. And iodine can help. Boron has been shown to help. Iron even 3.8 years in people with disease. And moderate supplementation, selenium, so 100, 200 micrograms, not more. And copper at medium levels in blood or amounts intake, a lot of years more. Also iodine at medium levels. So there's some conflicting studies that you need to give a high dose or a medium dose, average dose, not the highest level, and then you have the best longevity. And then we have special nutrients, and we're going to end by this chapter, is fisetin. And so this is each time a model, a session of the model of 2 hours average. And this fisetin is a plant flavonol, looks like this, occurs in many plants, and it's like yellowish, so it's yellow pigment. And you find it in fruits and vegetables, but especially strawberries, apples, onions, cucumbers, all these foods, grapes. A very high level here, but that's not so interesting because it's a little toxic, that one. And fisetin increases longevity in mice. So here's special nutrients, no proof in humans, for this one at least, but it also rejuvenates. When you give a supplement to mouse, they rejuvenate. And why do they rejuvenate? Longer median high span extends the lifespan, you see, by 15%. And so in us, it would be something like 10 years of life longer or 12 years of life longer. And you see that it's a senolytic. It eliminates senescent cells while the normal cells are kept okay. And it's the strongest senolytic of all these different plant flavonoids. And senescents are less with fisetin. And so I do a cure every 2 or 3 months of 1 month with 2 times 100 milligrams of fisetin. So these are the doses. So this is the cure I propose to my patients also and to my family members. And you see that 2 times 100 milligrams per day. If you're 55, 65 years, you need maybe 2 cures a year in general, 65 to 75 years, 3 times per year. So I'm doing a little bit more now because I'm experimenting with it. And I do, that's it, must confess, I do feel better. I feel younger. Several people have said you look younger than you looked 4 years ago. And if that is really true, well, it's probably due to these, partially to these cures. And together with quercetin, 2 times 500 milligrams per day, and spermidine, 2 times 5 milligrams a day would be optimal treatment. I also add now the PQQ, and I think it would be in the following. No, it's not the following. PQQ is pyroquinolidin or something that stimulates the making of new mitochondria. And doses is 10 to 20 milligrams of PQQ per day in that month cure that I do. And spermidine is here also. And so the spermidine has been shown comes from putrescine, which is sort of gives the bad odor to cadavers, but basically it can convert to spermidine. And we have that in almost all tissues, the spermidine. So it's not just the sperm. And it can convert also to spermine, not so important this, but look at this. This is in the diet you find in vegetables other than salads 30%, potatoes 6%, about 11% in salads, whole grains 6.5, and fruit 24%. So that's the main providers of spermidine, okay? And so when you have a diet, like in middle-aged old adults and studying in, I think in Italy, you have upper two tertiles of serum spermidine, the one who were the 67% highest intakers of spermidine, or no, in the levels in blood of spermidine compared to the lower tertile. They had, after 20 years, if they were the middle tertile, the middle 33%, 32% better all-cause survival than in the lowest people with the lowest levels. But those who went upper tertile, 82% more survival. Wow, that's a 5.7 younger age. So you're biologically younger if you take spermidine. And the average intake of spermidine is about 6 to 10 milligrams per day. So 10 milligrams will be the high intake. So try to have that in the food or add spermidine at least by cures. So one standard deviation increase spermidine, 32% more cause survival. And that was validated by another study who had similar results. So there are at least 2 studies showing that. And so spermidine supplements, spermidine like this, a daily dose of 0.9 milligrams seemed already to improve cognition, thinking, and some biomass. So this is one of the things we should always also do in a treatment, is take spermidine. Even 1 milligram can help cognition, but I take 10 milligrams when I do a cure. And so it's safe. And even 40 milligrams had been given to older men, and after a month, they didn't have any side effects from it. But I don't think you need so much. So in conclusion, there are special nutrients, and I also talk in my model about glycocalyx substrate, very interesting against atherosclerosis, but it also decreases all-cause mortality to take those precursors of glycocalyx. 3.2 years, and in diseased people, maybe more, 5.3 years longer life. Epitalon, 1.7 years you have to count. Spermidine, 1.5 years, probably more longer. Ginseng, 1 year to 2.3 years in sick people. Polydatin, which is sort of activated resveratrol. And then there's Ehrlichtin that I also talk about PQQ, maybe 1 year more. Rapamycin, 0.7 years. Visitin, quercetin, half a year. So you really have nutrients that are better than the rapamycin or the quercetin that so many people talk about. I also take epitalon for you to know. So just talking about, we have there's a new model on micronutrient supplements to extend life, longevity, that has 122 supplements screened like I showed, and much more details because you have, I just talk about a fraction, it's like 1/15 of all the information, and you also, I have books on hormones and reversing physical aging, but also I have a textbook of nutrient therapy, I have a textbook of lifespan and longevity medicine. And these are the books like Nutrient Therapy, Lifespan Anti-Aging that are very helpful for people, even for doctors, not only for nutritionists. And you can also have other books. There's my great grandfather wrote a book on hormone therapy that was very famous in his time. You can have that book also, but it's not in a paper format. It's sort of online. And uh, and then also we're building up clinics. So if you are a physician and you want to open a clinic, we can help you with all the material. We can make a deal that is completely okay for you. We can help you promote it, and etc. Also want to tell if there's a physician living in Belgium or near us that can work with us. We are trying to hire people who can work full time or half time at our clinic, and I can tell you it's fascinating. We have a little long waiting list for the moment, so we need new physicians, and we're really happy. Now, I want to introduce you to our partners, and we'll have questions after. So don't go away. If you want to have your questions, you will get answers. Our partners, and the first partner is actually Sunday Natural, who is founded in Berlin, but it's already a big firm. And I think it's Olivier Mimi who will talk about it. And I think you will talk also in English because everything is translated. And do I need to show you this also? This is
Yes.
also this slide. You see these products, and I must say I like a lot these products because they also have glass bottles. Not only is the quality good, but glass bottles is better than plastic because it doesn't outgas the plastic into the pills or the powder. So that's really interesting. Maybe can I let you talk, Olivier, and present a bit your firm? Do I need to
Yes. Thank
stay on this slide or this slide?
you can go afterwards. The next one.
There's the
Uh,
next one. Okay, here it is.
yeah. And yes, this one. Yes. Thank you very much, Thierry. So thank you first for the possibility to introduce Sunday Natural. Thank you for your confidence, of course, Thierry. So just to let you know that Sunday Natural is a German company based in Berlin. It was created in 2012. We are working with more than 13,000 doctors and therapists all over Europe, mainly in Germany, Austria, Switzerland, and France, and also Netherlands and Italy. We have a large range of product, and we are able to produce more than 50 million of capsules per week. And we have a very strong growth currently on the European markets as we double our production capacity within 1 year. We have more than 900 employees all over the world, and we have 160,000 podcast downloads per month. And we are present and we ship over 40 countries all over Europe mainly, and the north of Africa also. And a last important information, we have currently a range of products around 1,600 products, and we launch around 10 new products per week. So it's a hard rate, but we innovate a lot, and we have a true clean label philosophy for our products. So we source everything with a strong analysis of quality, and as you mentioned, we take care about the packaging with glass bottles exclusively. And we have a 400 pages book where we introduce our philosophy based on science, why we don't use some ingredients and why we use some others. So that's it. I think I told you the main important information about Sunday.
Thank you, Olivier. And I think your products are preservative free, or you do your best at it, really clean on all aspects. Huh? Thank you, Olivier. And
You're
then I
welcome.
think I have also Biosil. Richard, are you there to talk? Can you put on your video?
Oh, yes, thank you very much for the opportunity to present Biosil at this very important masterclass that you're hosting. BioSil is a dietary supplement that's clinically proven to generate and protect collagen all throughout the body. This is very important because a healthy person is about 7% collagen by weight, and typically a person needs to make about 1 kilo of new collagen every 10 days to properly repair themselves. Unfortunately, most people don't, and they lose about 1% or more of their collagen content per year. BioSil is the ideal protocol to support collagen health because it helps protect the collagen you already have, and it generates new collagen so your body can properly rejuvenate itself. It does this by activating key enzymes required to build new collagen, and BioSil also helps your body make the two most abundant amino acids in collagen, which are glycine and proline. More than 32 years of research prove BioSil makes clinically meaningful improvements to hair, skin, nails, bones, joints, teeth, and gum. In the most recently presented study at the European Society of Wound Management in Barcelona, even shows BioSil helps speed healing after burn wounds. So I encourage you to support your collagen production and health span by using BioSil.
Thank you, Richard. And I can tell that's many years that I prescribe your products, and they always are constantly very strong effects. So I have strong nails, partly due to your product. I like this solution. Thank you.
Thank you for the
Uh,
confidence and then the kind words.
Thank you, Richard. Is there another? Okay. Uh, okay, we don't have Vital Life, Vital Plus or something, but so we have now a question and answer session, and here's a question about Alice, who underwent knee surgery about 1.5 years ago, and she has a sort of pain syndrome and she would like to know what supplements could help actually in this because she also has a sort of I think was it fibromyalgia that you saying or whatever. Now, the first thing when there's pain, you should look at the diet. It's not only supplements. If you are eating a lot of sugar, you inflame. If you eat a lot of carbs, bread, whole grain bread, you inflame. So you need, and if you take milk products, you inflame. So you should switch over from the habitual diet to that is often a little toxic to what I call the paleo diet, the diet of our ancestors, where only fruits, vegetables, and things were taken. And that is helps a lot. But of course, you can take also, when especially in the knee, you can take glucosamine and chondroitin that helps against knee pain very well. They're very good studies. I also advocate MSM that improves the hair so well, and even but basically also decrease inflammation. I even have MSM gels that you can put locally that have a reputation of being anti-inflammatory. Those are my big ones. And then of course you can also give anti-inflammatory like omega-3 fatty acids like fish oil. Fish oil is much more anti-inflammatory than alpha-lipoic acid, the omega-3 plant oil. Studies show that there's no question fish oils are much better. And I can give you an example where I had a horse with a whole capsule full of, since 2 years, full of fibrosis. But when I put the fish oil there locally, it was placed after 2 or 3 days. Woof, it almost melted this capsule that was so hard to make. So omega-3 fatty acids, there, of course, there are many others that can help. But if you have a good food, a lot of water intake, the wipes out, it's also important. Water is anti-inflammatory. And I would say the omega-3 and chondroitin and glucosamine, you already have a lot of good things. I do also, to disinflame quickly, I ask the patients sometimes to be 4 days on a boiled only food diet. That means only boiling food and boiled vegetables, no fruits, and they disinflame very quickly. In hopeless situations, thing I do, and they very, very quickly disinflame. Of course, you cannot do that all the time. Also, fasting with some vegetable mixed in water, or curcumin and ginger can also help. So I have those drinks, and very quickly, 1 or 2, 3 days of fasting, I mean a small meal plus a lot of drinks with some plants really help. Then there's here a question on DHA supplementation. It's a little bit out of focus because we're talking about micronutrients, but I will answer this. Is that is it for men and women? DHA supplementation is something I always do because at age 50 or more, they all have deficiencies in 99% of cases. And so they receive DHA between 20 and 30 milligrams for women, or 15 and 20 and 30 milligrams in men between 20 and 50 milligrams. And it doesn't work in creams very well, the DHA. It's not absorbed to the skin very well, so it's better to take oral ones. And then oral, it goes to the liver, and the liver makes DHA sulfate. So that's a very stable levels. It's the best way to do, but it's not good to treat andropause. I mean, andropause is like a menopause in men, and they really need testosterone. So DHA is much weaker than testosterone to correct the andropausal syndromes like constant fatigue, erectile dysfunction, a loss of self-confidence and determination, and looking pale. And then to help avoid osteoporosis, DHA is not strong to avoid osteoporosis. It's something that you take as a protector against cortisol and it for osteoporosis. When women with low female hormones, the female hormones have greater potency to correct osteoporosis. And here's another question. Could you tell me what supplements are recommended for a 30-year-old who was diagnosed at age 12 with, I think, autism, a typical autism spectrum, such as thoughts dominated by imagination, overwhelming anxiety? Well, first of all, in autism in children, there's a wrong food intake. They crave for foods that make them sick. So the first thing is I put them on a low carb diet that is actually the paleo diet. Again, I come back to the Paleolithic diet, which is foods that exist since millions of years on Earth. And that type of food is more constant. And so no sugars, I take the sugars away, I take the bread away. I propose maybe much less milk products or no milk products if they grow well. And I put them on vegetables and meat and things like that. And they do actually much better. A lot of fresh plants, fresh fruits, they do better. And then if I have to give supplements, many supplements that have been shown to be efficient, even to increase eye contact that they don't have, is vitamin B6 and magnesium. And the best one of all is omega-3 fatty acids. You give fish oil, 1 gram, or sometimes a little more, but 1 gram can be enough to make them better. That has been shown in autism to work. And vitamin D also. Vitamin D also has been even to improve social skills. To give an example, I had 2 examples, is that babies who were born to mothers who took a lot of vitamin D during the pregnancy, just more intelligent. One of those babies at 3 years of age could talk Chinese because looked at the Chinese TV. Well, they're Brazilians and the parents didn't know. There was a Chinese TV and could talk Chinese. Another was the grandchild of a professor who was an expert in vitamin D. They took 10,000 international units during the pregnancy, and that had fantastic motor skills and much better orientation. So that's really very good for social skills. Now, you also, when you have autism, you need to look at the causes, and among the causes is lack of oxytocin. So take oxytocin that decreases social anxiety a lot, and you like people. You don't aren't afraid of meeting people. You like them. You're not disturbed by people so much anymore. You like them. And oxytocin really is helpful. I had several children get out of the autism just by taking oxytocin. And they may have some cortisol deficiency that gives them more energy and things like that. So every child is different. So it could be that as adolescent and even as adult, you have other hormone deficiencies. Growth hormone gives a severe decrease in anxiety. The panic attacks go away with growth hormone treatment. Melatonin at night also decrease. So there are several hormone treatments that are really efficient if you have overwhelming anxiety. That's help. I also believe that there's some spiritual reason or psychological attitude, and that can be worked on very well also, but it's like a global problem that has to be tackled, mind, body, and soul approach. But the approaches I talked with the food and the nutrients can maybe already make a breakthrough of 67% decrease of that type of severe autism. Here's another question. A person who fell has increased the magnesium intake, but doesn't really fall, but has consequences of the fall. And what do I recommend after fall? Well, first of all, what is the cause of falling? If you are getting older and you have no stability, you might be multiple hormone deficient. So you might be improved by getting the hormones. And I would think you have maybe a lack of muscles and stability that if you're as a male or a female, you need sex hormones. Male testosterone helps a lot. Growth hormone also helps the stature a lot. So you might be deficient in these types of hormones that are anabolic, build up your muscle system better and your bone system better. So I think that can help. Now, nutritionally wise, I take a lot of nutrients to improve my bones, really a lot. I take strontium, is helpful. You need about 200 milligrams. I take boron, 3 milligrams. I take the copper, zinc, and my bones are really becoming very tough with this because they were getting a little weaker. So I changed the situation. I take manganese, also very important. Some people get osteoporosis just by manganese deficiency. I take calcium, of course, magnesium, zinc. So I take a lot of supplements that you might need to strengthen your bones. But for the stability, I think you need hormones to have better muscles and be better skilled. Then there's a question here, is superoxide dismutase appropriate for people with Hashimoto's disease? Well, Hashimoto's disease, what is that? That's a disease where the body makes autoimmune antibodies against the thyroid, and that breaks down the thyroid or inflames the thyroid. But anyway, sooner or later breaks down the thyroid more and more. And people with autoimmune disease have lower thyroid hormones within the reference range, but like 10, 20% lower. And so they're thyroid deficient. And taking superoxide dismutase is not often done, but may be done because it's an enzyme that captures the very dangerous superoxide radical, but it mostly captures that one and neutralizes it. And the doses that are given is about 2 times 200 milligrams or 2 times 500 milligrams or 2 times 1,000 milligrams. But it's apparently the higher dose are not so necessary. And you need about 2 times 200, 2 times 500. And they decrease the oxidative stress. So Hashimoto's disease, they break down cells by free radicals. So you neutralize part of these oxidative stress. However, you also need to not neutralize only the consequences, you need to neutralize the causes. And among the causes of autoimmune disease is, again, eating milk products and the westernized diet. So you need to go on a better diet. Second, you need to give nutrients that decrease Hashimoto's disease, and that's vitamin D at a relatively high amounts, like 6,000 units a day. Selenium at also 300 micrograms a day, and myo-inositol, 2 times 600 milligrams a day, has been shown to decrease very well the autoimmune disease. Hormonally, it's often some thyroid hormones you need to give and cortisol that have the best effects to decrease the autoimmune disease, because usually I have very good effects in the sense disappearance of the autoimmune disease, what most physicians do not obtain because they just work with one product or 2 products, but not a gamma of nutritional and hormone supplements. So don't forget vitamin D, selenium, and myo-inositol are very, very strong. Myo-inositol, sort of vitamin B. I don't know if it's vitamin B8 or B10 or something considered, but it's one of the vitamin B, exactly. And then here are several questions. Is there any hormone reason for extremely cold hands and feet? even during summer. Well, that's typically low thyroid, huh? That's hypothyroidism 100%. And it's not only cold hands and feet, cold nose, cold knees, and in the nails, nails are whitish because there's not a good blood perfusion in the nails. And that means that the capillaries in the nails are not much open. They have to be rose, the nails, otherwise the capillaries are not much. And in other places of the body, also capillaries that supply the blood to tissues are not sufficiently open. So many other organs don't get enough blood supply. So you need to check your thyroid, and not only with blood tests, also with a clinical exam, a physical exam, and see how you can solve that. Other question, how to get rid of the Helicobacter pylori in natural way. Again, here is the food. The food is extremely important. You have Helicobacter pylori is a bacteria that actually can trigger cancer of ulcers in the stomach, but also cancer of the stomach thereby. And the foods that are really good are, again, fresh fruits and vegetables. Especially cruciferous vegetables have been shown to be perfectors, like cabbage and cauliflower, and also berries. Berries, so blueberries, strawberries, may be helpful. But what is not good is too much salt, sugar, spicy foods. So people in Thailand are eating foods that can give them more problems. Alcohol, drinking, and caffeine, they're too irritating for the stomach. So then the stomach is damaged layer, and Helicobacter pylori has more possibilities. Now, what is fascinating is that there's melatonin, 10 milligrams a day, has been given during at night during 3 weeks, and it seems to decrease very much the Helicobacter pylori. I think it's a small study in 10 patients, but there was no Helicobacter pylori after 3 weeks. But high dose of melatonin taken orally. Now, what is also interesting, the stomach is not germ-free. In the upper stomach, there are probiotics, gut bacteria. And among the bacteria, it seems that Lactobacillus reuteri, and there's a German firm that supplies it. You can give 2 times 200 milligrams per day during 30 days, and that may also be very helpful because there's a competition of bacteria, and that one is probably the good one against Helicobacter pylori. But also studies have tried it with Lactobacillus acidophilus or bifidobacteria, or the yeast that is helpful, Saccharomyces boulardii, and that also helps to maintain a balance so that Helicobacter pylori cannot proliferate easily. So think about that also. It seems that there are natural ways like cranberry juice that can be helpful, or even olive oil, but then extra virgin olive oil, that's very pure olive oil from the first press, not the second press, first press. And there are compounds that actually block the helicobacteria to stay in the stomach. They cannot attach themselves easily, and they seem to really be antibacterial also. So that there's a lot of things that can do. And this is probably a dental student that wants for what can you do in dental students? Well, dentally, you know that there's a microbiome in the mouth, and you can supply your patient. There's on the market, I think, Streptococcus salivaris. That seems to be helpful. There's I think, a brand that it's 1 billion germs that you put, and you have to let it in the mouth. So you put it sublingual. You have also vitamin C that improves the gums. That is very good. The vitamin D and calcium. So you have several nutrients that can be helpful, and you can probably, it's like the gut, you have probably a lot of things to do. I want to show you one thing is the following. This works wonderfully. I searched all the literature many years ago. What can help for periodontitis? So there are nutrients and vitamins, and put there a mixture that is water soluble with vitamin C and folic acid and zinc, And you can try to make a picture if it's interesting for you. And then you have fat-soluble vitamins that have been shown to be helpful against gum disease. Okay? So it doesn't mix together, so the pharmacist doesn't want to mix them, but they can make the two solutions, and then the patient mixes them. And each time before he takes it, you do in the morning, because this can keep you awake at night, so you take it in the morning. You do a mouth solution, a mouth bath, and during one, or I would say even 3 minutes, you do like this, and then you swallow. And even if it's severe periodontitis, you have a fantastic improvement. I really, people who had years of problem, went to many dentists, never worked. It works this way. But the coenzyme Q10, you have to put cubiquinone because that's the only one that is stable in such a solution, not the cubiquinol. And this really is helpful. Other question was, what is a perfect breakfast? The evening meal is often the good breakfast, and you should almost not eat much at night. So the paleo supper would have to be taken in the morning, and that's ideal. Not to eat much in the evening and much in the morning. And then proteins give energy. So if you eat meat in the morning are much better, and you will digest everything. You'll have an empty stomach when you go to sleep. You sleep much better. Do you support using creatine routinely for everybody and what dose? Well, I take every day about 5 grams of creatine, mixed with in a powder form with carnitine or acetylcarnitine. I fluctuate between these two, plus glutamine, plus collagen peptides. I take a solution, a big soup spoon, so that's more than 15 grams, like 25 grams or 20 grams with the whole, and sometimes also in the evening if I didn't eat much protein, and I see the difference. So, but creatine is among those. It seems also to be not only helpful for the muscles, but also for the brain function. Maybe that's part of my better brain function for the moment because I have insights one after the other. You're going to see the information I'm going to bring. It's not just this, much more. I'm an 19-year-old female. What should I care about the most right now regarding health and hormone-wise? Well, a baby is born now with 6,000 different pollutants in the fat tissue. That's the average. 6,000 pollutants that didn't exist 100 years ago on planet Earth in different concentrations. So it's enormous. And of course, they still survive. They're still not so bad, but the health is not fantastic. So at 19 years, you probably have also pollutants in your fat tissue. So you should do detox programs. And one of the best ways is just to drink detox drinks, and plants help a lot. You can learn about that. That's certainly. Now, if you have complaints, you should probably think maybe you have some hormone deficiencies. It's never too early to start when you have, because it doesn't damage your glands to take a correcting dose of your. So you should look at on our website, we have different questionnaires where you can check if you're likely to have a hormone deficiency based on your complaints in physical science. And you have already an idea. I also published books like that, like a hormone solution book and things like that, where you have also that information. So I would do that. I would try to screen. I would also think, what am I going to make for my life? Am I going to have a life that is average or top level life where I feel good, better all the time? Because the most important thing to live long is not the nutrients and the hormones, is feeling good. People who feel good compared to people who are very, very stressed, 15 years of life difference. So people are stressed and worry all the time, they're going to die too soon. And why would you be in that group? So why not build up that you are on this planet Earth blossoming all the time? You will blossom others by feeling good, not by being nervous. And like my generation, we did a lot and we forgot to take good care of ourselves. Take good care of yourself first, love yourself, appreciate yourself, and you're going to appreciate the others and love others and things. So I would work well on psychology, eat a good diet, which is a paleo diet, and maybe check your nutritional and hormone deficiency with an expert and get advice. But also learn yourself, because the more you know, the better it is. On internet, you find confusing information. So you should try to read good books of people who have a healthy mind and know what is more and less important. Because many books are published now with everything is important. And you don't know what's more important for you. So maybe you need to go a health professional can sort you out and slowly you learn also what is more important. And then you'll know better at age 30 or 40. You're going to be yourself the expert for you in your health. And I think when you work then with physicians, you'll choose the right physician each time better and better. That's what I would advise. So are there any other questions? Before I just give you some information is that there is Wednesday, May 6th, 2026, also 8 o'clock Brussels time. So same time as now, I will talk about restoring the scalp and hair, reversing aging actually, on the face, skin, chest, abdomen, and more. And so we'll talk about a lot about hormones. There will be some nutrients because you can know it's soup. And maybe I'll slip some things like optimism, 26% less wrinkles. And if you're resilient, you react to situations, you take your life in hand, also less wrinkles, for example. So you get that type of information that will say you, wow, there's something out there that I need to learn and maybe apply. And we also have other, like in Cancun, we'll be talking at the Congreso Mundial of Gynecologica, I think, of Mexico. And also in October, there will be a free webinar, but the information will come in November. And then in December, I'll probably be at the biggest World Congress of Anti-Aging Medicine, the IFRM, where it's called Longevity Fest, where I usually lecture quite a lot. So these are all the firms and our partners, Vital Plus recently also. I must thank them. Energetica Natura are also, NP Compounding Pharmacy are good, and all these other pure encapsulation. Sunday Natural that we just had, of course, BioNurso, they all are groups that really are supporting us, and we thank them for this. And here, if you want to have more information, there's this type of email channel, hertoghe.eu, where you can get more information and get all our things like it. We'll try to have some questions, but normally it's almost finished, so I'm not sure if I can, yeah, stop share. And there's in the chat box some questions. Or is there here? Wow, there are 97 questions. Won't be able to answer very many. Which are the supplements for 20-year-olds living in New York City? So again, I think it's not only nutrition, it's hormone supplements. But if there are some basic supplements, I would suggest is magnesium, vitamin D are probably among the two most helpful. And then depending on your state, if you're a woman, you often at 26 years, you have iron deficiency, you supplement some iron. Look at the vitamin B's, maybe a B complex could be good because easy folic acid deficiency and vitamin B12 deficiency could be helpful. And maybe as a trace element, zinc is often the most deficient. Here's in Turkish. I cannot read it in Turkish, sorry. And L-tyrosine here is a question that is in French. Can it help for a person with thyroid deficiency? Not very much. If you have a thyroid deficiency, you cannot convert tyrosine much in thyroid hormones. It's better always to correct the hormones and then maybe add that tyrosine is better for neurotransmitter formation, but even hormones improve the formation. So L-tyrosine I don't use so much. It's not the best. And so I have 10 minutes. I can continue. Which brand of amino acid powder do you take? Personally, well, I don't want to talk too much about that because I take several brands and I don't want to make any about it generous. But there's a brand in the United States, for example, that put in paper and it's blue and that brand seems to be best, really good. I like to have collagen peptides where you have a mixture, like a complete mixture with hyaluronic acid, and they're really good ones. We can give this information if you send a little email to the address we can give you out offline. The ones I take. You mentioned that I hyper, but I do fluctuate a bit. I get some free samples also. You mentioned that high protein adults below 65 years increase the all-cause. Yes, this is true. And cancer, but it's probably due to the cooking process of these. They grilled and things. Then there's a person who thinks that glutamine can feed the cancer cells. Any amino acids can help cancer cells in lab cultures, but in the body, the glutamine improves the immune system so much. So in the body, in vivo, it is more an anti-cancer treatment that is helpful. And we have it anyway in our food. There's a lot of foods are rich in glutamine in general. But I think glutamine in a person who's undernourished and has cancer, perfect to give. You have to look in vivo. Yeah, so it's always this idea that glutamine would be dangerous in cancer cells, but that's based on in vitro studies, meaning on cells. It's like growth hormone. Growth hormone is one of the best hormones to counter cancer in vivo, but in lab cultures, it stimulates all the cells, but much more the immune cells. So I think that's better. You have to look in vivo, and we have it anyway. If without glutamine, you'll be malnourished, you'll have sarcopenia, weak muscles, and a low immune system because glutamine is one of the best nutrients that can stimulate the immune system. Yeah, okay, the same question here. So people who want to review this will be on, I think, our YouTube channel. You will be able to have access to this lecture. Can give glutamine so someone who has an ulcerative colitis medication? Yes, I think there wouldn't be any problem. Also, it's not contraindicated in epilepsy. So we go for here. Person talks about intake of nutrients that have are antioxidant. Antioxidants really is something you may not do lifelong. You have to interrupt all the time. I mean, at least every 2 months, a short time, in order to have the occasion have enough free radicals to kill cancer cells. So I do a lot of sports. So my sports permit me to do a lot to kill cancer cells because you have free radical formation. So I may eventually take it all the time, but even myself, I stop in the weekends my antioxidants and I never take too much antioxidants during a too long period. How should amino acids be given? Capsules, are they really good absorb? Is it powder with amino? I think powder with amino acids always better because amino acids can always stick slightly on the capsule. And you know, amino acids have to be given in bigger quantities. So if you take a powder, it's easier. Just do a solution, drink everything, and you don't have to swallow 15 pills. So I think amino acids is better in powder form. I have a question here in a person who likes to drink coffee. Uh, Very strangely, coffee gives a lot of problems, including more cancer and acidifies the body, so you get heavy legs, acidic sign of acidification. But I looked at the all-cause mortality studies, and apparently caffeine is linked with 20% less all-cause mortality intake, but you may not take too high amounts. One study showed that it's not true in middle-aged adults that you have more mortality. That's the biobank, the big biobank study of United K. But otherwise, it's helpful with 2 cups a day or something. And then there's still 5 minutes and left. Okay. What is your opinion about what? Okay. So many questions about plasma vitamin D. Why in Belgium is vitamin not taken together? Yeah, good question. So vitamin D is not taken with K2 in Belgium. Well, there could be combination products. German firm has a combination of 5,000 international units of vitamin D plus 200 micrograms vitamin K2. This is what I take as a dose. I always take vitamin K, but the reason I take it is because I take a lot of calcium. And it's true that separately, vitamin K2 improves bone formation. You could even take it separately against osteoporosis. And then you have a doctor who takes 10,000 intravenous D3 in most patients. Now, therapeutic dose, there's another meta-analysis that shows you need to take 4,000 international vitamin D. Now, my personal dose fluctuates between 5,000 and 10,000 international units per day. I don't take it intravenous, I take it per day, and there's no danger at that dose. 20,000 could be a problem, but 20,000 is the right dose for athletic persons, do a lot of sports, and are obese persons. And then is this going to be recorded? Yes, you can watch it again after. And we're almost going to stop. I have some, what do you propose for renal deficiency with, for alpha-lipoic acid can be given if you have a leaky gut. Of course, it can be given. Alpha-lipoic acid, it's very good. And okay, what is best magnesium for sleeping? Magnesium bisglycinate is the most relaxing form, or magnesium taurine is also a good form. What are the times off and on for vitamin D3? Maybe stop a month or two in the summer if you go to the sun. What is the right dose of vitamin C a day? I don't think it's a high dose. 500 milligrams per day is the dose I take. What is the right dose for, but I don't have a disease. In disease, you take more. What the right dose for zinc and copper? Zinc per day, 20 milligrams, 50 milligrams, or 100 milligrams, you have a disease. But for a healthy person, copper is around the 3 milligrams a day. And okay, I have to stop now. And thank you for all your questions. We have more than 114 questions, so I won't be able to answer them. I'm sorry I took a bit more time by explaining everything. I hope you enjoyed, and I thank you. And I thank again the translators for doing your job. So Galia and Sue, thank you for your good work. Bye-bye. Hope to see you in May back on the webinar. I hope you enjoyed. Bye-bye.